Okay. This is the Richland County Community Health Service Standing Committee, Thursday, July 2nd, 2026 at 10:30 a.m. in the Richland County Boardroom. So I've called the meeting to order. Need a roll call, please.
Miller. Here. Kramer.
Here.
Engel.
Here.
Welty. Here. Perry.
Here.
Collins Johnsford. Ferris.
Here.
Braithwaite.
Here.
Chicker.
Here.
We have not an 8 for a quorum.
Thank you. Okay, and we have verification of open meetings law compliance.
It has been properly noticed.
Thank you. Next thing is the approval of our 11-point agenda.
So moved. Second.
All in favor, please say yay.
Aye.
Aye. And all opposed, please say nay. Number 5, approval of the minutes from the June 4th, 2026 meeting. Everybody had a chance to look at those? Find any corrections or additions? Hearing none, I will declare those minutes approved. Number 6, any public comment from anyone online or anyone here? I just want to bring up one thing. July 11th, that is a Saturday, starting at 1 o'clock, out at the American Legion Post 13. We are going to have a retired Sergeant First Class. He actually was a guard for the Tomb of the Unknown, Washington, D.C. And he will be here to give a presentation. He's going to show a film first, and then he will talk about his experiences to the public, and then you can ask him any questions. So if you're interested in that, please attend. It is open to everyone.
What time does that say?
It starts at 1. Okay, moving on to reports. Start with your administrative report, please.
Sure. So in your packet, you have some updates from the various units. From myself personally, it's not on here because at the time I wrote this, I didn't know this, but I have a new business and finance manager that will be starting July 20th. Offer's been sent out. I'm waiting for the formal acceptance, so I hesitate to say more than that until I get that letter in hand. So very excited about that. And then just the big thing right now from my desk is working on the 2027 Health and Human Services budget. We did get the guidance from the county administrator, approved by executive finance. I think the big things in that are they want us to try and work in increases in wages, a step and a 2.5% COLA. There's going to be some increases in health insurance that we'll have to budget, and then of course the big thing was a review of vacant positions. So I've been working with the county administrator and working with her on those things and seeing what we can keep and what we can let go, if we can let go. All of the managers, they do their own little expenditure breakout for me, tell me what they think they need or whatever, and then I'll plug that all in and we'll see what comes out on the other end. I'm scheduled to meet with the county administrator at the end of July to present it to the county administrator so they can bring the whole county together. And then so my plan is to bring a summary to you all in August to kind of let you know what I've presented. And I would like to invite any committee member in the meantime, if you wanted to reach out, set up a time to kind of I do a summary budget every month. We do that, but if you're interested in some of the more of the details in our budget and how that breaks out a little bit more, especially when it comes to revenue sources, I know that's always something that's everybody's usually curious about. I invite you to just reach out to me and we'll set something up for you to come in. From the ADRC, been busy. Roxanne's working on getting the 5310 operating grant, the capital purchase grant done for 2027. We offered Dementia Live to our staff internally. They did that earlier this week, and it's definitely an interesting experience. ADRC is encouraging individuals to get their power of attorney for healthcare. with the new, Patient Representative Act 115 though. It's just gonna be nice to have all of those things in place so that you have a, you know, a better say. It will help you with those things. Men's Shed still going strong. Child and Youth Services, about 170 reports last month, 20% screening, which is standard across the state. And keep an eye out for an announcement. The YES program, they do an annual fundraiser, and then they pick a charity to donate to. And this year they're going to donate to Ada James, but they do a car wash, brat and hot dog stand. So watch for those announcements out there. Come and get your car washed on that day. Behavioral health unit, busy, so busy. It's hard to even pull numbers together for us, but I just know that they are very busy out there in our outpatient clinic and with our CCS program. Economic support continues to take a lot of calls, do the casework. You know, we just did annual report last month, so not a lot new there. And then just giving you a heads up that sometime next year, there's going to be a work requirement attached to individuals for Badger Care that are enrolling in Badger Care. So similar to Flu Share, they're attaching that to Badger Care as well. But that's going to be next year. We can report out on the impact to the Richland County residents once we know a little bit more there. And public health. Communicable disease updates are in there if you have any questions. CHIP updates, mental health substance, even though we lost Evan, the community is still continuing to do that work. With that, we're going to have to actually start working on the next plan for the next 5-year cycle. That's actually going to be due in 2027. So that's already on our radar. And then just a highlight in there right now, we do have an open public health nurse position. We're going to, Evan was a public health specialist, but we thought we'd try to see if we could fill a nurse instead. One or the other, not both. So if you know of anybody looking for a nursing position that is steady hours, Monday through Friday, send them our way. That the ads out there. And I think that's about it. Okay.
Anybody have any questions? I have. Well, I'm sorry. Go ahead.
Fund 54. Can you tell me, it looks like it's 61% used for the year. Does that go January to January, or does that go July to July, or how is that going to affect?
Yes, that's January to December. That's an annual cost. Yes.
Is that going to be enough for us for health placements?
We shall see. I know there is a high cost placement right now. If we are able to get that facility CCS credentialed, should be able to push some of that to the comprehensive services program against Medicaid reimbursement. But there's a potential for that to possibly go over that amount. I'd have to go look. There is a cash balance in there that should be able to offset that. But shouldn't have to come and ask for additional dollars at the end of the year to put into that fund. But
Do we have a check and balance to make sure that that person's getting?
yes. Yep.
Is that
Yep.
continuing?
Weekly meetings, all the things. Yep. Everything's happening there. We have our actual person working on that. Yep. That's the goal.
I have a question.
And fingers crossed that nobody else has to sit there. Yeah.
The Dementia Live, and Brittany, I want you in on this too. You can answer it too. Have staff at Pine Valley that, you know, are newer, have they ever been through this, or anybody?
We have dementia certification.
Okay,
So our staff have an online course that they get certified through. And that's assigned to everybody upon entry. It's about a 10-hour course that they go through to get dementia certified.
okay, but this Dementia Live is where they actually put the goggles on, or, yeah.
Yep, we have Laura, who is dementia certified for like Train the Trainer, and she has all those lovely gadgets, the glasses, and just kind of how things look and feel to
Right.
residents.
Yeah.
So she's going around and doing that as well. So they are getting the experience. And then we also have our therapy department that does a lot of dementia education, things like that. So,
Okay, I was just wondering, because this
Yeah.
Dementia Live is a very good program.
it is very important for our staff to know and see what that looks like and feels like.
Any other questions?
Under the MCH update, it indicates that, that's where I saw
Are
that.
are you looking at the,
No, it's a CHIP update.
okay,
Public health.
It mentions National Night Out presence. What, do you have the booth designed or planned already, or is that in progress?
That's in progress. National Night Out is gonna be on August 4th, out at the fairgrounds, and Health and Human Services, will have various booths out there. So individuals can come and, it's just an opportunity to do some outreach about what's available. Yeah.
anybody else?
Just me, I may have lost track of where we were on the agenda, but we seem to be jumping around. I don't know. This is Cindy.
Yep, we're now gonna move to the expenditures report. And yes, there was a question about that
About the
earlier,
placement
about the placement, yeah.
Yeah.
So.
Yeah. Can we kind of stick to the agenda without going back and forth? Especially if you're not in the meeting room, it's hard to keep track.
We're moving on now to the Health and Human Services expenditures report.
Sure, so, I reviewed the report, we have our volunteer driver expenses for the month, and that's, just standard, something we do every month. For everybody that, takes people on trips through the transportation program. Purchasing card expenditures, those are broken out, not only by vendor, but we also include a little description of what was purchased. And then the program that it was applied to. I didn't see anything on there that jumped out that wasn't standard or normal. There's this, that E-trike down at the bottom, but that's the CLTS program. That's a pretty high cost, but that'll be 100% reimbursed, through Medicaid because it's CLTS.
I have a question about that.
Yeah,
Remind me again what CLTS stands for.
Children's Long-Term Support Program.
And what, how's the accountability and use of it, long-term ownership? Is that given to the person and it's up to them to decide if they're going to use it and whatever happens to that e-trike, or, and that is a significant expense?
They would not purchase the trike for them if there wasn't an intent.
Sure.
Yeah, as far as longevity, yeah, as long as that child is in need of it. Are you curious if staff are making sure that it's being utilized? Or I would think in the case management process, they would ask how things are going.
Yeah, my concern is it's a significant expense, and it seems like since it's been determined that it's a necessary expense, that there would need to be some type of oversight or accountability, and then long-term care for it too. It's one thing to purchase it, it's another one to take care of it. And
Well, and also, is it capable of, how large is the child? Is it capable of being used for more than 1 or 2 years?
That'd be a question for a direct case manager. And that's a question for Medicaid services, as far as what they allow. Because we wouldn't have purchased it if it wasn't allowed through Medicaid.
Yeah, I'm not questioning.
Yeah,
that it's
no.
reimbursed. I just want to make sure that it's cared for.
Oh.
And that it's used, because my concern is individual can't afford to purchase the bike, that's why it's being provided for them. Are they able to take care of it, or is there some kind of maintenance that's necessary and provided along with the purchase?
That would be a question for a case manager. I don't see any case managers online right now. I can take it back.
Is it like a regular bicycle or something like that? Or
It's probably a 3-wheel.
It's probably a 3-wheel.
usually
That's
they're-
what a trike usually is, yes.
It's usually under a warranty, so like all of our power chairs and our wheelchairs are warranty. somebody services it if there's issues, but I don't know about a. That's how our equipment is. I would think if it's Medicaid like ours, there's a requirement for a warranty.
Well, it could be a transportation issue if it's a teenager who needs to get to school or doesn't get lost. I don't. Oh, no.
Yeah, no,
Might
that's a
be
great
really
question.
valid reason.
It's a great question. I can have your manager speak and I can shoot you an email.
Yeah, I just want to make sure we are also providing care for it.
Yeah.
So that it's maintained and so we continue to be. That is a significant investment.
Yeah, no.
Any other questions? Oh, yes.
Nope, that was just the. Okay, then, then the expense approval report, I reviewed that as well. It's, mileage reimbursements, our cell phones. You'll see a lot of Quick Trip. That's because we have an agency vehicle and we charge gasoline to Quick Trip. It ends up being a lot cheaper than paying people out mileage to use their own vehicle. So we encourage that use. You'll see a thing on there called Savants, that's $1,375. That's for employee in and out tool that we use at Health and Human Services, which we're transitioning from, because now that we have teams, we're going to transition to 100% teams. But in the meantime, until we get our processes transitioned, we went ahead and purchased that. Just paid for that. Language line for interpretation. Again, more mileage reimbursements. SmartNet switches, that's a computer thing that they tell us we have to have. And that is, those things are usually, we do pull together a specific computer budget. And I work with MIS to create our budget every year. So that would have come out of that. The Christopher Kettner Mazo Catering, that's for our meals, all the meals for meals.
Anybody have any questions here or online? Anything else? No? Want to talk about the placements, adult placements?
Okay, so we'll put on to the next one then, okay.
Yep.
Okay, I could talk about replacements and then we can go back to the budget, or budget first, or
Let's do. We'll
Thank
do
you.
that. Yeah, we'll go with the budget.
budget first, okay. All right, so our budget this, through May 31st, our utilization should be at about 42%. If you go down and you look, our total utilization is at 33%, so that's a little low. So I kind of did a deep dive, did some checking. One thing that I did discover, and I have actually had a conversation with Leanna, the finance director. Our first payroll of the year, our first payroll, January 2026, the auditors had us, because it was, that payroll was for paying for the time worked in 2025. Auditors posted it back. So I've had some conversations with Leanna, so now it looks like I'm behind, on my budget. I'm under budget, but I have this extra payroll that I already accounted for, in my budget. So until I hit that, there's just gotta be some work done to clean that up so that my budget matches how many payrolls we've had so far. So we've technically had 11 payrolls in 2026, but this is only showing 10. So I have to work on that, tweak that. So, because either at the beginning or at the end of the year, it's still gonna have to, some's gonna have to get adjusted, right? Because I budgeted for 26 payrolls. I need 26 payrolls in 2026 for my budget to be at the utilization that we're anticipating. So that was kind of something wonky that I discovered. And I think they did that in April maybe, and it's just now showing. So that kind of accounts for a little bit of it. But if like building and operating costs is at 43%, a percent over, I did take a peek. We spent a little more in our postage line than was budgeted. So we should be good though for postage for the rest of the year. Shouldn't need any of that. I think I've explained that we also get hit with workman's comp and some other insurances at the beginning of the year. So that'll balance it out as the year goes on. Nutrition is a little low. I didn't get too far on that one. I don't know why that one's a little bit lower. Some of the other ones, child and youth services, we've been without a couple of social workers. So that always kind of impacts that budget. CPS contractual services, that's that varies. That's also how much money we spend on legal fees, if we have to pay for anything legal or TPRs or anything like that. It's also our kinship. Subsidized guardianship comes out of there. And so that again is dependent on how many kids we have. We always budget based on what we think we're going to have for the year. And so we're under there. AODA outpatient is a little low, again, a vacant position. Same with birth to 3. And our therapy in birth to 3 is only at 23% utilization. So working through that. Children with disabilities. That's a little bit high, but I think that was more for payroll allocations. So the beginning of the year, the various workers that they're split between the different programs, we kind of plug them into each of the programs we think they're going to be working in. So my guess is they're working a little bit more in CLTS than we anticipated. So there's that. CCS is low. I did kind of look in previous years, we did have a high cost placement that was in CCS. And so then we were able to charge those costs to CCS. That's not the case this year. So that would be the explanation there. And then that's always a month behind. So on how we pay those bills, because we always want to make sure that all the providers that we use, that everything is good to go with all of their documentation before we will reimburse them for their work.
Stephanie, at the end of the year, is that adjusting entry that takes place so that you have the charges that were incurred each year within the finances for that year, similar to what's happened with payroll?
Yes,
So the lag, is that adjusted then at the end of the year?
Yeah, we try to do that. Yeah. And then so you take all those expenses, you plug in the revenue so far. Anticipated revenue, again, is claims that we've put out there for all of these expenses above. We just haven't seen the revenue come in yet. And so core balance, I'm showing a surplus right now based on those estimates, but I'm projecting that we're pretty much on track on our budget overall.
Any questions?
About the budget, the placement report, did we roll to that? Sorry, didn't jump through the budget. Any more questions on the budget?
All right, moving on to placement.
So you've already noticed we're at 61% utilization, which is high. Again, because of that one high cost placement that we have right now that we're trying to transition to CCS. Offset that. There's work being done every day by our APS, our crisis, the behavioral health manager. They're in conversations. I wouldn't say every day, but conversations weekly for sure.
Is this the same?
That's the same one that I just mentioned. Yeah.
And the holdup is replacement out of institutional placement. What's the problem?
Well, sometimes they might, so next month, I'm thinking in June, there was a transition. But what you'll end up seeing is So in June, there was a transition out of institution. It'll go to more of a community-based setting, individual. So you'll see those costs transition from institutional down to the bottom row, right? That cost is less than the institutional cost, so there'll be see a little bit of a decrease. But until that community residential facility is hopefully enrolled in CCS, that'll stay high, so.
You, speak again to how the mental health services we provide keep this number low.
How the mental health services we can provide, keep this number low.
Keep this number low. There was an argument made that mental health services, if I remember correctly, helps keep these institutional costs down by providing more direct services.
So for the one example that was given was, because we had mental health staff we had our outpatient clinic, we were able to put the person in touch with, connect them with psychiatry services right away, right? For med management and those kinds of things, so that we could transition out of the institution into the home-based setting, right? To get them to lesser restrictive. If we hadn't had that, there were no other psychiatric providers that we could have gotten that person to. So then we would have had to then wait list dependent and all those things. So, and then that of course increases the cost. So we were able to move them out of that setting quicker. And that is a lot with our referrals for our CLTS, and because some of those children need those supports, child and youth services, by having it internally, they have those supports that they can shift to internally and not have to worry about wait lists in other places or not have anybody available. It's kind of an example.
Yeah, those are stories. Is there any hard evidence on that?
Hard evidence. I'm having Leanna work with me on looking at some historical placement figures, and then looking at the participation rate, the placements, and having these services, especially like CCS and all these programs, is there a correlation to that? So yes.
That'd be really helpful.
Yeah, we're looking, we're trying to pull the data right now. I did ask the if she could go back and pull some of that for me. I did find that we did have it used to be part of these reports years ago, where they had kind of an annual timeline of that, and kind of when did we have an outpatient clinic versus when we didn't, and all those kinds of things. So yeah.
Yeah, that's one of the questions that often comes up, so it'd be really helpful to have.
Yeah, sure. Yeah, but yeah, I already had that conversation with Anna, and I haven't forgotten your request about participation trends. We're working on that, getting those numbers pulled together and hopefully have something.
Yeah, I recall you said it'd take a few months.
Yeah. But I thought it was timely if we can do it with the budget and all of this, program, all these program questions. So
What are the totals of how many people you serve in the at the adult level and at the children's level? You have an idea of a number, Jenny? Totally.
sure. On the report, I don't know if you can.
Yeah, I can see that report, but I'm thinking you must take care of more than 31 people in May and totally that we give money to, and then down here, 101 adults. Is that the total of what the county takes care of? I'm the total people count.
It's the days of stay.
So I think are you looking at the days, not the people?
Oh, okay.
Yeah, so currently, so far in 2026, we've had 15 individuals that have been in, like Winnebago, Mendota, Miramont, based on, assessments and crisis situations that they're in. We have 7 that are in, a community-based setting currently that are on protective placements that the county is responsible. It's not necessarily individuals we've served though, right? These are just ones that have risen to the level of needing this type of care.
You have 300 people a month oversee or?
That we service in
Yeah.
mental health.
Yeah.
We have to get those numbers pulled together for you. Total served.
I'd like to know the ratio of staff, mental health staff to the numbers that we are serving. What are their caseloads?
Yeah, I know.
Any other questions on placements?
And obviously children's is super low. We don't really have anybody in placements right now. But knock on wood.
Summer's here. Summer's. Anything else for us, Stephanie? Off the hook until number 8. Okay, moving on to D, Pine Valley Community Village Administrative Report and Financial.
Good morning, everyone. So just kind of goes over the census, average census, our current admissions, discharges, because we take care of both long-term and short-term patients. So again, short-term stays, we have respite stays, and we have a few of the respites coming up. So like family need a break, they admit them into Pine Valley for, you know, anywhere from 5 to 14 days. So that family's on vacation and kind of get that break. Down here for regulatory and survey, when I submitted this last week, survey had not shown up, but they did show up on Monday. And we completed our annual required Medicare, Medicaid, survey that says, checks to see if we're doing everything appropriately. We had our life safety, so I'll kind of go over those with you guys really quick. So life safety came in on Tuesday, so he spent the entire day with us. We actually got very small, little, like a couple sites in life safety, which is huge. That's fantastic on our end. So we replaced all of our outlets down on in the skilled side to medical grade because it was not built with medical grade outlets. So we replaced about 100 or more of them down there. We did do a 1 point check on them, but they require a 4 point. If it's medical grade, it's just a one-time test. We don't ever have to do it again. But we did the 1 point, they requested a 4 point. So we did get a small case citation for that. So all we have to do is go retest them and then we're done. So we have, they call them penetrations to the wall, which is a hole. And it's not like inner wall, it is pipes. So when it was built, they caulked or did the fire retardant stuff around on the outside, but they didn't do it in the attic. So they call it a penetration. So that was in one of our offices. It was like a small, tiny little thing, but that's already been repaired. 300 and 400 in our soil living rooms. Again, it was a pipe that went up for water, and the outside was done appropriately, but the inside was not completed. So those are already repaired. We have pictures. So that'll take care of that. The insulation is kind of loose up in the attic, so it kind of sprays everywhere if there's a gust of wind. So it ended up covering up a sprinkler head. So they called it a dirty sprinkler head. That's already been cleaned up. So we got a small citation for that. And then, yeah, that was pretty much it. We had a generator, but we had all the paperwork. We just had to get the paperwork. We didn't get our fuel test from the generator testing company, and then the 4-hour load test that was required on that end. It was like one of the worst days for life safety to come in because of all the heat and the fact that our roof isn't ventilated appropriately. So our pipes were sweating significantly and coming down onto the floor. So it was leaking out. So we had to obviously wipe down a lot of the pipes. It was on practically every wing. And we got an FYI to put the ceiling tiles back. But yes, he did temp it, the life safety gentleman, because, you know, we explained it's hot up there. We don't have proper ventilation until our roof is repaired. And all that. So it was 189 degrees in our attic where all of our heat pumps and everything sit. So we have the fans and everything, the solar fans and the ventilation being put in with our roof. And then during the heavy rain, we get spring leaks in certain areas. So those will be repaired. They are coming out on the 20th to do the roof. So that will be completed probably on that week. They're going to try to get it done within the week. As for outside of life safety, just a regular annual survey. It was fantastic. We got 2 citations, 2 small citations, nothing significant. And dietary, so nothing in nursing, nothing in housekeeping, nothing. It was just, like I said, very small citations. They came on not just the annual, but there was 4 complaints. All the complaints were unsubstantiated. There was no merit to them. So we were within compliance on those. We did a self-report on a significant med error that they came and looked at. Technically, the medication error is called not in compliance. So it means that something happened that wasn't appropriate, but we were able to put ourselves in a past non-compliance and got no citation for it. They checked out scope of practice. Just because we had that citation previously, LPNs were doing assessments that they weren't supposed to do. So LPNs can gather data, but they can't actually put together an actual assessment. So they were doing that. But they checked that. They checked our med techs. They checked our all of our med techs. They pulled all their files and nursing, and then they looked at charting. And we are within our scope of practice. Everybody was kind of put back in, and we have not had any concerns with that. So the actual citations we received was F812 storage. Our main kitchen didn't have the disc, so now FDA requires now that we have to internally temp the dishwashers. So what we see on the outside is no longer enough. So we have them on the main wing, so that was appropriate, but apparently there was one that was missing out of the main kitchen where we sanitize pots and pans. So we've already got that ordered to be put in there. And then just some dating issues. We have some new staff. And they would put the open, not the expiration date. So they had some concerns with that. So we've got the education already put together for that. And then qualified dietary manager. So I have to apply for a waiver for her because she's enrolled in CDM school. And this is how the previous CDM was done, is they were put in the position, they were enrolled in school, it wasn't an issue, but apparently they just request that we have a waiver. So I've already requested that. That's already in with the state of Wisconsin. So I'm just waiting for the approval. So yeah, those were the only 2 citations we received. Very small citations compared to when I first started. Yes.
Is that an annual survey that's done? So you would expect another one next year about the same time?
Between 9 and 15 months. So our window opens up between 9 and 15 months, correct? So every year they have to come and make sure we do everything properly. Our CBRF is every 2 years, so they're biannual because of the licensure. But yes. Questions on our annual survey? Yeah.
Can you just expand a little bit on that medication area?
Yes.
Is anybody injured? What's the correction?
Yep. So we had a gentleman who's on seizure medications. We had a nurse, an LPN, not read that his particular seizure medication was located in a lockbox. So she assumed, she signed it out that she gave it, but did not actually get it out of the box. So that night he did have seizures. So that would be considered the adverse event that occurred. So essentially what we did is provided education to all nursing staff about reading the actual order because we want everybody to know where it's at. Made sure all of our PRNs were labeled appropriately, like we went and got stickers from the pharmacy to make sure they were located. We drew labs on him, had a physician follow up, a good RN assessment, and did some significant education with the staff members. I'm trying to remember what else we did. Oh, wait, I have it listed. Dandy notebook here. I wrote everything down that we did. We did an ad hoc copy with our medical director. We did an audit to ensure no other medication errors were found, which there was not. And we did a complete re-education with the nurse. So the nurse involved actually sat with our charge nurse and did an entire re-education shift with them. So she re-signed her off on medication administration. She re-signed her off on basic like nursing skills. And so we did everything appropriately and we were put into a past non-compliance. Yes.
I'm confused. Okay, so she signed off that she gave the medication, but she did not.
She signed off in our MAR, so so we have to do like a lot of doubles and a lot of like do things 4 times and for one thing. So she signed it out in the EMAR, did not sign that out in the book. So the book is where it says you need to go into the lockbox, sign it out. So the count was not correct. They were able to catch it pretty quickly. And we were able to intervene. He did get an additional dose. We did call the physician, we called family, we did all the appropriate things. But it's as simple as thinking that a seizure med is going to be located in the strips that they get. So we get all of our medications for our residents prepackaged in strips. So most seizure medications aren't in a lockbox, they're usually in the strips. But he's on 2 separate seizure medications. So his one seizure medicine was in, one of them was actually in the strip. So I'm assuming she thought it was the correct seizure med. Maybe I wrote it out. Make sure everybody did their part.
Was it a one-time situation or an ongoing?
One to one. There was nothing after that. And it corrected, the nurse got appropriate education and the state was very satisfied with the education provided.
Questions? Clear?
Yeah, Jennifer. A few months ago, we got this big citation from the state. Have we got that paid off yet?
Yeah.
It's done.
Yeah, we got it. I was able to get it dropped down, I think by 30-some%. Let me look at my email. So instead of the 114, it was 79, I want to say. 79,000 instead of 114.
And what about the roof? What is that started?
Sorry, what?
Are you starting the roof? Are you?
We're going to be starting the roof July 20th.
Considering the efficiency you're finding in the facility, which is what, 10 years old? Is that due to people that constructed it or the people that designed it?
I guess it's really hard to say. I would say both, because if it was designed without the proper ventilation, then it's a design flaw plus the construction build.
Well, people that constructed it either did follow the plan
Or
they
did
didn't.
not. Correct.
To know
Yeah,
how to determine that.
and I've never seen the designs and I never seen any of that information to be able to determine whether or not it was either or, I guess. I can always check, but I even know where to begin to look for the plans. But I can try.
It's probably too late to do anything about it now.
Yeah, most of them have like a 10-year warranty, so we've hit that warranty.
We can put their names on the list. Not-
Right, do not hire.
My question was just answered, so.
Oh, yes. Questions?
I was wondering about lack of staff. What are we, that could be an issue with care.
So our staffing is wonderful. We get compliments every single year from state about how well we are staffed. Having our own staff is one thing. It'd be fantastic if we had our own. But we actually, versus, we try to stay away from like utilizing clipboard like one and done, like they come for one time, whatever. We try to use contracted staff. So like we know we're getting several weeks from them so we can train them, we can educate them. They spend time in the building and learning our policies and procedures. Luckily for us though, with clipboard, we have a good long-standing continuity, and we have a select few that we utilize off of there for repeat come back for them to come. So we don't allow for brand new ones to come unless we fully vetted and they end up picking up several. But otherwise, we have a cherry-picked few of our favorites that have been consistent in the building and our residents enjoy.
You get your contract staff from?
So we utilize a couple different agencies. We utilize Grape Tree, we utilize Clipboard, and Emergis Healthcare.
Do you have any internship programs with Southwest Tech Nursing or Turbo Nursing or?
So we grow our own CNAs. And then we can send them off to become med techs, and then, you know, we're putting out the VA and we have tuition reimbursement that they can utilize as well. So we're trying to input that, but again, you know, once people start getting the things that they, you know, for practically free, they try to use that and go elsewhere to make more money.
Is the program at Spring Green where they get the veterans in automatically? Have we ever?
Yes, I have it. So I actually was emailing the veterans place, and they were in between. So they said that it would probably take about 6 months for me to hear a response from the new lady that's taking on the contract team. So I'm still waiting if they actually receive that person coming in for the contracts. My goal was to reach out by August because that would be the 6-month time frame.
So where is this? Chicago, or where? Not local though. No one like Madison.
No.
I know there's always issues with placement with the veterans. They're either too sick, or not sick enough. You know, it always seems like they have to put it aside. But Spring Green does a good job, but I mean, they only have allowed us 6 beds or something like that, so.
I'll have to look at the email to find out.
It's federal government, I'm sure it's Chicago. Washington.
Yeah, I would have to look. But I don't know if one of them actually are located out of Madison, if I'm not mistaken, because they have a VA hospital there.
Yes, they do, it's big.
Uh-huh. Yes, so the therapy department, Christina, she's the one that was able to give me the contact, and I was just told we might have to wait several months while they get the new one trained. Um, Maintenance, like I said, we talked about the roof replacement, the reservoir, again, that says something in the future, like it's supposed to happen. It actually happened the day state came in on Monday. So the reservoir has been repaired and back to normal, which was good because DNR requires every 2 years and state looks into that. So we were fortunate the day before they had finished it and we were able to hand that off to state. Dining and nutrition, again, we meet with our residents on a monthly basis for menu planning. Some of them, like I said, are more pickier eaters or somebody that, you know, has more complaints than others. We have a weekly meeting with, so we're hoping to kind of have a more frequent check-in with her, to help alleviate some of those concerns that she has, or maybe doesn't like something, so. Resident council, we had resident council, there was no major concerns. No complaints. They're enjoying their activities, they just went on a fishing trip. So they're able to go on a pontoon and fish, so they were really excited, and really enjoyed that.
When was that trip?
That was the beginning of June, and then the end of July, we're having a wallaby come in. So they're gonna bring a wallaby.
Oh, cool.
So the residents are extremely excited to see one of those.
And the donkeys came.
And the donkeys came, so we all got to enjoy that. Any other questions? We can go on to financials. So the first report you're gonna see is expenditures. And then I was only able to give you guys the very final page of receipts of like cash received. Just because the report I run has resident names and I can't provide that information.
So the difference between expenditures and revenues for the month, how is that difference accounted for? Is there funds that are put in reserve for repairs, for debt repayment?
So we put the money, it goes all into like our general operation funding account. But mind you, these expenditures are like what we spend out of pocket. It doesn't include like our payroll, so our payroll also comes out. But that's not on this report, and we don't get the payroll reports from the county right now. So that's something that Leanna and I are working on to try to at least show that payroll piece that comes out.
So the difference is overstated on this report, then it shows that there's more fund balance remaining than there is because payroll has not been removed from that.
Correct, because this is what we pay as for our accounts payable, so it does not include like the payroll piece.
And you said you're working on providing that?
We're working with Leanna. Again, we don't get the payroll reports from the county. We don't see any of that. So we just send over a spreadsheet to them. They do the payroll and then.
I would find it very helpful to have a clear understanding of the financial situation here between what is the remaining balance, is there one? And how are those funds allocated, reserved for future repairs, debt repayment? What is the remaining balance?
The debt repayment here is done here at the counties. The county does the debt repayment here. For, like I said, the excessive funds, it goes into our general operating checking account.
Yeah, I appreciate that, but I'm not seeing what the net results are.
Right, and that'll probably have to come from Leanna.
Yeah,
period.
I think
Yeah.
that'd be very helpful to have that.
Yep, she's more than happy to come to these. I don't know if she's on vacation right now, but she's happy.
Particularly as we are budgetary season to really understand what is the net position here. It's not clear. Financials.
You know, when we get to future agenda items, do you be more specific on that is?
Yeah.
So that we can have it.
Any other
The
questions?
more specific, better would be.
Any other questions on the financials? Wes? All right, Brittany, one last thing, your organizational chart.
So this is what we submit to do our Medicare revalidation, our Medicare and Medicaid cost reports. This is what goes to them to show who's all involved in our general day-to-day operations. We have our medical director, we have a consult pharmacist, we have a registered dietitian, we have physical therapy, occupational therapy, speech therapy. So those fall under your consults. So we have our director of nursing. We have an RN manager for the 2-300 side. We have an RN manager for the 4-500 side. And then we have our licensed staff, which is our RNs, LPNs, med techs, CNAs, RAs, our unit clerks who are our hospice contact. So we have to have 2 designated hospice contacts in the building per state federal regulations. So they do all the uploading of like the medical records, they schedule doctor's appointments, they schedule transportation, CNAs, and then resident assistants. And then we have a scheduler, essential supply. So she falls under the nursing administrative. So she does scheduling of our nursing staff. She does the central supply. She starts the infection control line list as she takes call-ins and the filling out the yellow slips so we keep track of the illnesses. And then we have our director of social services, and then we have a social worker. Each one of them is responsible for a side. We have the activity director and then 2 activity aides, because we do activities on the weekend, so we need those. The dietary supervisor, we have a lead cook, and then food service workers, and those all have a one that's because they cook breakfast there on whatever they want, so they cook breakfast on each wing, and then the lead cook, so they serve. We do not have the business financial manager anymore, so we just have AP and billing specialist. And then so we would utilize Leanna in that finance manager position, but she's here at the county. Then we have a required medical records. We do have a human resource generalist out who manages all the background checks. She checks licensures, the OIG. She has to do all the education and she works the floor. Environmental services, we have our maintenance director who oversees both laundry and housekeeping and environmental services. Laundry workers, those are outsourced, but we still have to put them on even though they're outsourced. So laundry comes in and goes out. Housekeepers, we have housekeepers between 3-4 a day, because each of them are required to deal with each wing and the main areas. And then we have a maintenance worker for the PM shift for obvious emergencies that we've been having with leaking. And then just some things that need to be done, like, wheelchair repairs, if residents not in them, and then just kind of your overall generalized repairs in the building. And then we have our CPRF. We have Natalie, who's the CPRF nurse supervisor. She handles all the orders, wound care, things like that down there. We have a unit clerk down there for medical records and maintaining appointments, scheduling rides. And then we have our personal care workers. Yes.
I hate to ask you, but what is the difference between a nurse's aide and a resident assistant?
Nurses aid are our license, like your CNAs, and the resident assistant is there for like support. So they do the they help with laundry, they make beds, they, pass waters. These are the ones that we start as an RA and transition and work towards getting them CNA certified.
So they do bedside nursing. That's what I was asking.
Any other questions on the organizational chart? And you put in what you said was missing.
Oh, I'm sorry. We do have a charge nurse on night. So when we originally got the citations for scope of practice, it was we had LPNs doing things outside of their scope of practice, and that was mainly because usually on the PM shift, we have one RN because we don't have a lot of RNs in the building. And then they're getting pulled down to the CBRF side if a fall occurs or something, a major catastrophic occurs, our nurses are required to go down and address like falls and like if there's a change in condition that's significant. So the goal was to try to alleviate that if we only have one RN in the building on the PM shift, was to alleviate that need of having to go everywhere and doing all the change in condition and assessments. So when talking with Trish, we've always had charge nurses in the building. We just didn't have it at the time when I started. We decided that the PM charge nurse would be the most appropriate. So it's only one a shift each day. So it's just to cover for changing conditions. So he has to go out to the ER if the CPRF needs help, if an admission comes in and it comes in the afternoon, they're able to do the appropriate assessments. But we have a lot of med techs and LPNs in the building, not a lot of RN coverage because pay.
So Pine Valley had its own business manager at one time.
Mhm.
When did that transfer come?
That occurred last year. Yeah, our AP and our accounts receivable are very sufficient. If we were to ever do a finance director, we wouldn't need a full time. We wouldn't need somebody there that's 5 days a week. Because like Kayla, she's the accounts payable and payroll. She's self-sufficient and is able to get me reports for like what she pays out. And then I have Haley. She's the accounts receivable. She does all the billing. She does all of that. So there's really wasn't an actual true need for somebody to oversee that department.
Question then is if you use that with finance, about human resources.
Human resources, what do you think?
Yeah, why wouldn't the human resources be done by the county?
So when you have the county, which is much different, there are a lot of requirements that we have to maintain each month to make sure we remain in compliance. So if we put that task on the HR here, she would have no time to do anything but the things that we need her to do. And that's running background checks, that's doing the OIG checks, that's doing licensure checks, that is doing all the education that we need, that's writing up all disciplinary actions, that's and like I said, our HR person is capable of working the floor, so she tends to come in and cover floor hours as well. So I mean, if you take that away, that would put a lot of stress and a lot of time.
I'm just asking.
Yeah, if we even thought about doing something like that, that would take away and she wouldn't be able to do what she needs to do here because it is a full-time job, just looking at certifications and assigning educations and doing all those things and hiring, doing the orientation. That's happening here because they do orientation here for like benefits, but then they have to come and get educated on policies, procedures. They have to get their orientation checklist. They have to get put with the right manager, and then they have to do all the things that we need them to do here. So they do their required paperwork here for benefits, and then they come and do all the policy procedures. And that's something that our current HR does to ensure everybody is competent upon walking in.
Will the future January Medicaid cuts affect?
No, because ours are PDPM. I don't see a huge issue with the changes or a reimbursement. Our current Medicaid reimbursement rates went up due to the care levels in which we're taking. So we don't see it, and we won't know the actual effect until January hits because, again, we got our rates increased from our Medicaid cost reports, and until they're ready to cut, we won't actually see what happens until it happens. Hopefully it doesn't affect us too much, but
Anyone else online? wanna stick around or you wanna, that's stuff you wanna go?
I've got finish up my plan of corruption. I'm almost done with it. It's like, I'm out of here. A long week. I didn't get out until life safety is the one that always drags out. Didn't get out of there until almost 7 p.m. I was there at 6 a.m., 7 p.m. just for that day.
Well, thank you. Thank you.
Yes.
Okay, number 8. You, Stephanie.
That's me.
Yep. Discussion of possible action. Request to create a new economic support lead.
So this is a position, so to a little history here, I don't know if you remember, and I shared this last month, but the county, signed a resolution last October, to send on to legislation, they were, in support of this Wisconsin Act 116. This Wisconsin Act 116 was an opportunity to, after, some information came out from the federal government on impacts to the food share program, from an administrative perspective. How do we, continue to make counties whole? And how do we prevent, having to pay these, penalties, for food share errors? And some of these errors could be not through any fault of anybody. It's just how the system is set up. So last fall, the county board signed a resolution in support of this act. And then I think I reported earlier this year that the Act 116 was signed, and it's all good to go. Governor Evers signed off on it. And the biggest piece of this is it's going to help offset what could potentially be up to $205 million in penalty fees if error rates exceed 6%. And in the nature of how the consortiums are set up, how costs are distributed now is it the state distributes those costs to the county or down to the counties. And then the counties then, depending on their consortium, distribute it to the counties. So any penalties that come from these error rates could have a significant impact on Richland County. So yes, so yeah, part of this Act 116 was funding was added to specifically for what we call quality assurance, right? Individuals, they gave us money so that we can do this quality control work, right? So that we can catch errors before they happen. There's a tool that these cases can be put into. They can run them through before our benefits are ever even issued. And the goal is to keep these rates, keep our rates low. Currently, Wisconsin is in a good place. I think we're just under 6%, but it's federal fiscal year. And I think as of a couple of weeks ago, we're around 12%. It's early in the year, so it'll hopefully not be so scary at the end of the year. But again, the goal is to create positions across the state. The money is specifically to be used for quality control work. And so the consortium leadership met, directors, supervisors, managers, and the decision was that each county is going to each county would create a lead position and be paid for out of these dollars that have been allocated for this work to prevent this really big penalty that could potentially happen. And so that's what this request is. The money is actually available right now. It was available yesterday. Contract Dane County is the lead for our consortium. They have the contract already from the state of Wisconsin. So now we're just waiting to get that contract here. So this request is to create a new position mid-year. So this has to go through you guys, through executive finance, and then on to county, full county board. I have already discussed this with the administrator and the county board chair. And they are approved of moving this forward. And so you guys are the next step in this. Money.
Do I hear a second?
I'll second it.
Yep.
Sure, I was gonna say, yeah. questions. I have
So
More
the
to say.
salary is what, and are the benefits also
Correct.
included?
That's salary and
Overheads,
fringe.
and what percent overheads are included in the 93,000?
This would be based on somebody having like full family insurance, health insurance and all of that. Would be. I think I would know right off the top of my head what is a good percentage to tell you.
And then the other question is location. Do we have adequate space?
Yes. Yes, we actually have 8 cubicles that were added several years ago, 10 years ago, when we hired on the 8 economic support specialists back in 2015. And now some of those individuals work at home, remote, so we have space.
So is funding indefinite or is there?
That's our understanding is the funding's indefinite. Right now, it's in Act 116 through 2027. So we need the position now, and then in 2028, then they're going to roll that into our base allocation.
So as you look that up, and you can let us know, you know, over time, because I'll probably be asking that question anytime you bring something forward, what percent overheads are included and what are all in that? Is it, so I'm assuming it's insurance,
It's
computer, equipment that they would use, their phone, whatever, those are the types of questions I'll be asking.
Okay.
So if you want to look it up and you can tell us next time, that's fine.
okay. I can tell you the salary and fringe and all of those things. The fringe includes FICA, includes WRS retirement, it includes health insurance, life insurance, dental insurance.
So kind of the payroll deduction.
It's the
kind of
payroll
stuff.
stuff. Yeah.
Okay,
Yeah.
and then the other aspect is the tools that they'll need to do their job, whether it's a computer, a phone, whatever specialty software they might need. So when we think about the overall financial impact or budget impact to the county, those are some things that we want to take into consideration. The question is, are those all reimbursed also?
Those will be reimbursed as well. Yes. I believe right now we have some spare equipment and phones and everything, so as my understanding, it won't impact the cost now, but if there's like a future need 3 to 5 years from now, that would just be part of our normal budget.
Is there any work that's currently being done in the county that could shift to this person and maybe offload some responsibilities from someone else? Are we currently doing some of this elsewhere?
Well, currently we have one lead that is doing some of this work already. So what's happening is what did they say? They have to do over 1,000 cases a month is going to be the requirement by the state of QC. So just this person alone, just taking on that addition, that's gonna, I mean, across 8 counties, but it's still, yeah. I think they said like 1,000 cases a month. That's what they're required to be pulled. So,
It's AI that probably need AI to help with the analysis.
yeah. The state is spending some money though on this quality control tool that you can use, and they can just plug these cases in and plug through them. So hopefully that tool will be helpful in that regard.
I just wondered, are they gonna eliminate vacant positions then?
This would be a brand new position.
So what was discussed with executive finance is to evaluate all vacant positions.
Considering that's.
Because it's additional money. Makes sense. Specifically for this one.
Yeah, second for discussing. Any other questions or discussion? Because you know, Stephanie, it's gonna be, as long as it's first, I don't see where there would be any problem. 2027 is gonna be tight, you already know.
I already know that, yes, I do know that, that's why, it's important. yeah, for me to make sure that there's no tax levy impact. That's understandable.
And this is basically mandated item numbers.
Correct. About
Yep.
40%. 40, on this particular salary, it's about 40% fringe.
40% seems really light to me. So we may want to take a look at that and determine what isn't included in there, what is included, but there are other aspects of it, like software application, software licensing, things like that.
I see what
that
you're saying.
impacts
We've never broken that out.
Positions. But if we're thinking that our overheads are only 40%, that seems extremely light to me.
So, okay. So you're talking more overhead than fringe. This is true fringe. So you're also looking for like an overhead of a position. What is a
Well,
position?
If we're
cost
saying
for
that the
overhead?
financial impact of adding a position is X, but we actually have additional expenses associated with having that position. We want to, I think we should be discussing, in my opinion, the complete impact to position that we add. Otherwise, we are having additional impacts that were discussed when accounting for when the decisions.
I see what you're saying. Okay, so you need the overhead impact.
So there's the actual pay that they receive, there's their insurance costs, the fees that are paid by the county that are payroll related. But there's additional financial impacts from each position. So there's computers and app software licenses, and I don't know if you need an additional chair and a desk or whatever, I'm sorry.
Mileage reimbursement.
Yeah, whatever the other training or other pieces of it. In typical business operations, it's at least 100% of the salary, oftentimes more than that. It can be 125% sometimes because there's additional costs.
And so I'm just sitting here thinking, I'm thinking that's gonna come from adding up all of the other expenses in that particular unit, right? So, because they also have like office supply lines and computer supply lines and all those things. And then you could divide that out by the FTE count. And
So if we're expecting the reimbursement to be the salary plus fringe, but the county is actually incurring additional expenses, that is a concern because that could be levy. And if we're asking for full reimbursement, we should be asking if that's allowed. Under the program.
How many positions statewide are they offering?
they actually allocated statewide. I know our consortium's getting like 11.4 million. No, that's not right. I think it's 11.4 million statewide. Statewide. I know they're creating some state positions as well. But I think those positions are going to be the ones that are going to help. Because there's statewide QCs that also happen in addition to the individual. The state has to do these federal QCs. And that's what's reported to the feds. This quality control work is going to be for all of the front end work, so that by the time it gets to the state federal QCers, there's no, the penalties will be low. I know it's in here.
Can I chime in real quick?
11.4 million statewide.
Yes.
I was trying to say something.
Brianna? Go
Yeah,
ahead.
okay, I was just gonna say that, I'm sorry, I didn't hear the whole question, but I can tell you that the consortium got enough money for Richland, Adams, Juneau, Dodge. Basically everybody except for Dane and Sheboygan to get 1 lead. Dane is getting 6 leads and Sheboygan is getting 2 leads. Of course, each county pays different. So it's not, it's not as simple as taking the money and dividing it out to see how many leads or anything, but that is how they divvied it out. I don't know if that answers the question. Like I said, I didn't exactly hear it, so.
I don't know, I guess I'm looking, I'm not sure if I'm looking at this correctly, but it looks like there's 16 project positions. And ending in 4 years after that date. So this is not like.
We were told that the money would be built in after. So they put it into the budget and then at the next budget, it's gonna be built in. If it's not, we would have to cross that bridge when we get there. With maybe some unfortunate decisions, but right now we were told that would be built in.
I'm wondering, you said it says after 4 years? Do you know which
I was looking at page. Page 5, assembly.
of the assembly bill? So that's where my understanding is that, the bill is for now, and then for the next biennium, they'll take this money and then they'll roll it into our normal income maintenance base. The new biennium. That's what the communications have been. Because I know our Dane County lead, director, manager, she's been having those communications directly with the state, right? Because all the counties are having those. Wait a minute. We hire this person now and in 2 years, money's gone. So then what? Yeah. So, but we have communications.
I'm sure it's different than state budgetary.
Right.
But I see it says that for years.
And that's always been sort of an income maintenance agreement too, as well. Those 8 leads that we hired back in 2015, if we ever got to a point where we would need to ask for additional tax levy to fill those positions, then that's where Richland County is like, we just can't do it anymore, right? Because the agreement was always, we'd only keep them filled as long as we didn't have to add additional money to it.
Those can then be amended to, as long as it's legislatively funded position.
Sure.
We can do that.
So I would move the entire resolution and the phrase, as long as the position is legislatively funded.
You second it. Sure.
And I'll work on a resolution, right? Start.
Any other questions? Now help me here.
So we vote on the amendment first.
Got to vote on the amendment first. Let's, all those in favor of the amendment, say aye.
Aye.
All those opposed, say nay. So you just joke. So,
Clear
okay,
my throat.
so the amendment is approved. Now we got to vote on the actual resolution. And all those in favor of the resolution as printed.
So to clarify, I don't have a resolution in here, or it was part of it in here.
Yeah.
Position.
Right, request to create a new economic support lead position.
Oh, the agenda covers in there, so then I would create a resolution on to executive and finance. I'll write that up, but yeah, I didn't type that up, so apologies for that. I'm still learning processes myself.
That's okay. So we need a vote on the request to create a new economic support lead system. And action is needs as resolution. So all those in favor of the resolution? Original,
Of creating a resolution.
creating the resolution. Say aye.
Aye.
All those opposed, please say nay. None. Resolution will be created with the amendment that we asked.
And that goes to the school
This has to probably go before finance and exec first.
Yeah.
Yep.
third.
What? So it'll have to be the next one, right? So this one was Tuesday.
Yeah, the next one is next Tuesday.
Yeah, so
14th.
it'll probably have to be the next, whenever the next one is. Okay.
Last one is
July.
the 27th of the month.
That's Tuesday.
I think that agenda's already out, but you do it twice a month, right?
I don't think the agenda's out yet.
Next.
That's okay. We'll get one.
Okay,
We'll catch one.
it'll be in there somewhere.
We'll catch one.
Thank you, Steph. Is there any correspondence?
Miranda, I have not received any.
Number 10, future agenda items. Yes.
I have one. I request that be added to the agenda, the overall financial position of Pine Valley, both on a monthly and year-to-date basis, indicating after expenses are paid and revenue received, what's the net position? And how does it compare to the budget? So are we in the red? Are we in the black? And are we on budget? Yeah, the actual position as compared to the budget. I'll second that.
I'm trying to think this, salary fringe and overhead discussion. And since the county hasn't been thinking that way in terms of its presentation, should we put that on the agenda again so we can further that thought? Maybe come up with a recommendation.
Sure. Yeah, so what I'm thinking about it is when we're asking for when we're expecting reimbursement positions. Are we fully reimbursed or only partially reimbursed? Is it reimbursed for salaries plus benefits, or is it the full financial impact of having?
We are reimbursed for the full financial impact, depending on the program, right? Economic support, I can do 100%. I can submit all these overhead, I call them AMSO, all these overhead costs. I can submit all of them. The computer supplies, all of that are 100% reimbursed.
So and this might be executive finance, but when positions are presented, that we include the full financial impact. Because we're missing part of the picture, it's salary plus pay benefits.
See what you're saying.
So we won't do that here with executive things. Okay.
Well, let's talk about that. So as part of the 27 budget, so there's a lot of services that are under contract. Are those contracts rebid on an annual basis or periodically?
Provider contracts are not rebid.
State requires.
For providers, for procurement policy for service providers, it's not required that we bid those. Because basically, anybody can say, we would like to be a provider with you.
There's gotta be criteria. Licensure and all that type of thing.
Yep. So we have a compliance person and somebody that monitors all, make sure that they are eligible to be a provider of services.
I'd like to explore that further in a future meeting. Because what I've
Not
heard-
bidding providers, not bidding out for providers.
Well, the process and overall, how does, I think we need to think through what is the process that we're following in the financial of it, because what I've heard over the last couple of meetings is that individuals can choose which providers they want, and that contract and providers aren't paying it out, so there's a lot of expense there. There's a lot of potential for exposure for expense. And is that a competitive bidding process? Is it not? Or anyone can apply to be a provider? I just think we have, what I've been learning through the review of financials is there's a lot of money that flows through, some of which is reimbursable, but which is not. And is there a way to approach that maybe in a different way that can help us better predict what our costs may be on a basis?
I guess I'd like to, being a state employee, I was very aware that we had contracts. We contracted with different providers, but there was a competitive bidding process. So I don't understand why county level would be any different. It is.
So to bring this complete, you have to count the office space, the desk, chair. You'd have to have that all broken down for every position in the county in order to be accurate.
Or the state provides a formula to use, or somewhere there's a formula to use. And it may be that there's inconsequential expenses that are additional that we're already incurring anyway, like office space. But there are other things that can add up, like computer software. It's like that costs more than a desk chair.
And I think you're kind of asking the county as a whole too, right? Not just HHS or.
Well, I think.
Because we do, so we do have a formula that we use to create a cost per FTE that I can claim every month based on the program that they're in. And that comes to about $15,000 a month or $15,000 a year per FTE that I'm able to submit for reimbursement.
So that's in addition, is that in addition then to their pay plus their benefits?
Well, it's
15,000, or does that cover?
So what does it cost to have a health and human services agency, right? What does it cost to have that building and the office space and all the things? And I take that amount, divide it by FTE, and then I submit that. So it's not really a cost to the physician necessarily. It's a cost to the agency, and then I'm able to draw down those dollars based on how many FTEs I have. The fewer FTEs, the less money I can draw down, right? To offset a cost that I might have, whether or not I've got 20 people or 10 people, right? I'm going to have an electric bill and a heating bill and all those kinds of things.
So I think that type of discussion is more appropriate for executive finance. So.
Yeah, that's what, I'd be happy to break anything out in any more detail.
Sure.
That you would like.
But as far as the contract part,
And I'll probably have to get with the county administrator on that question, because that's in the procurement policy, that we don't do competitive bidding for service providers because like you said, of choice and all of those things. So if somebody wants to be a children's long-term support service provider, there's a process they have to go through with the state that they submit that they'd like to be a provider. And then
I'm thinking more mental health. AODA help.
Sure. Yeah. I would say probably almost all of those are our comprehensive community services program providers. And we don't limit that because of patient choice. But yeah, I can expand more on that, on why we don't do competitive bidding for those things.
You have all that, Miranda? Future agenda? Not, we can clarify it for you.
I have the, financial reports for Pine Valley, including like that position of Pine Valley, more specific, basically. I'm a little unclear for the, discussion of salaries and full impact, if that's,
Don't have to worry about that.
okay. Okay, I'm gonna strike that one, and then I have discussion on provider process bidding process for contract. That's, there's only so much you can fit on an agenda.
Yes.
So I'm just trying to be a little bit more concise.
Okay,
If that's
that's
what you all wish.
Over to adjourn.
there's a second. All in favor?
Aye.
All opposed?
I'm sorry, I missed 2 seconds.
I did. All opposed, you may stay.
And it is, and I can understand the aspects of the personnel
back.
services.
It just seems like a quiet, but.
Yes.
Yeah.
And where are saving
Okay.
Versions was in this.
Yes.
Yeah,
And I think we should.
I shouldn't have gone.
I don't know,
back.
should this-
You know, that's right. I think that's what
It's like 5%.
it doesn't.
Well,